A very good day to all of you. Today we are going to start the 10th lesson from grade 10 Health and Physical Education lesson series. And the lesson is about overcoming challenges confronted in life. So let's get started. In this part of the lesson we are going to talk about the sports related injuries. Injuries which are caused by sports can be called the sports-related injuries, and these can be divided into two as external injuries and internal injuries. So, what are external injuries and internal injuries? External injuries are visible. They are surface level damages like cuts, bruises, and sprains. Whereas internal injuries involve damage to organs or tissues or anything within the body. It could be fractures or concussions as well. So here we have a list of external injuries and internal injuries. Bruises, lacerations, cuts, piercings and blisters come under external injuries, and injury to bones, joints, muscles, ligaments, nerves and other internal organs come under internal injuries. And we'll be looking at each of these separately in the next few slides. So there are some personal factors and external factors that we should consider when it comes to sports related injuries. So these are like factors which can cause sports related injuries. If we look at the personal factors, level of physical fitness, if it is not adequate for the sport, if it is not adequate for the intensity of the sport, that might cause injuries. And then participating in sports without warm-up exercises. It's really important that an individual warms up before performing any kind of sports. Lack of proper training, that means if you are not familiar with the postures or the movements that you have to do in a particular sport, that can also cause injuries. Not taking adequate time to recover after a sport. So after doing a sport, it's important that you take some rest. That means you need adequate time to recover, because doing a sport might injure your muscles and bones at micro levels. So that's why you need to rest after doing a sport. Overtraining, that means you're straining your muscles. This can also cause sports related injuries. Adopting wrong training methods and techniques, that can also be related to postures, wrong movements, which can cause sports related injuries. Taking part in activities that are not age appropriate. So that's also another cause. Poor physical health, if you are not strong enough, if you don't have the necessary factors like maybe muscle endurance and all the competencies that you need to do a certain sport, and if you're not physically healthy, that can also cause injuries. Not taking adequate amounts of water and food, that means it comes along with physical health. You should be strong enough to manage the sport, to manage the movements that you have to do in a particular sport. So these are like the personal factors that can cause sports injuries. And then there are other external factors, like if you are not wearing safety gear recommended for the sport, it can cause injuries. And if you're also using improper sports equipment, maybe damaged ones, old ones, torn ones, that can also be a reason. Lack of standard playgrounds. So there are these standards recommended for playgrounds, not only as rules of the game but also for the protection and for the safety of the players. So it's important there's a standard in the playgrounds. Not observing the rules of the game. It's important that you observe the rules, because they are also part of the safety precautions taken for the players. other environmental factors. It could be certain weather conditions that might lead to sports injuries. So now we are going to have a look at the external injuries. Under that, we'll be discussing about bruises, lacerations, cuts, piercings, contusions, and blisters. Let's start with bruises. So a bruise is a skin injury, and this can be caused by an impact or due to friction. And what happens here is that when the skin brushes against a rough surface, it could be either the ground, it could be any other sharp objects, or even other external factors like thorny bushes, that is when a bruise might occur. And the characteristics are that there's no heavy bleeding in this case, but it can cause skin discolorations, either red, blue, or purple. The treatment is to keep the area clean to prevent infections, and then you can first wash it off with water and then apply a cold compress to reduce the swelling, and you just have to let it heal naturally with simple care. So bruises are a type of injury which usually heal on their own with basic first aid. Then there are lacerations. So a laceration is an irregular tear in the skin. This is often deep, unlike the bruises. This is deep, like it could be deep as almost like the full thickness of the skin. And this usually occurs over a bony area with bruising. So this is also known as contusion, which we'll be talking later. So in a laceration, what you can do is you just have to apply pressure with a clean cloth to stop bleeding, because there could be a lot of bleeding involved. So you apply pressure with a clean cloth to stop bleeding, and then you can bandage the wound to prevent infection. After that, it's better to seek medical attention, because if it's too deep, it might require stitches or surgery. So lacerations need proper care to heal and avoid complications. You just can't get away with it, unlike the bruises. Then there are cuts. A cut is caused by a sharp object like a knife, glass. Now that is in general instances, but it could be applied to sports related instances as well. This can be superficial as well as deep. It could be at a surface level, or it could be a very deep injury. So if it is like a deep cut, that might even damage the internal organs as well. The treatment is to apply pressure to stop bleeding first, then you clean the wound to prevent any infection. And it's better to immobilize the area if the cut is like deep and might have damaged the internal organs. After that, you seek medical help. Like especially if bleeding is severe, you have to seek medical help as soon as possible. And for cuts also, you need proper care to prevent infection and complications. Here we are going to talk about piercings or piercing wounds. So a piercing can be caused by a sharp or pointed object like a nail or a needle, and a small surface wound, this is a small surface wound, but it can penetrate deep into the body. That's why it's called a piercing wound. It can penetrate deep into the body, and there could be internal bleeding, hemorrhage as well. And it is more likely than external bleeding. Like you might not see it externally that the wound is bleeding, but it's actually internally bleeding. So when it comes to first aid, you should not remove the object. Like if it is still in the body, suppose it's some sort of a shard, a glass shard, make sure that you do not remove it by yourself. Just do not remove it, keep it still, and seek immediate medical help. And like in the meantime, you can apply pressure around the wound, like if it's bleeding externally, and try to keep the injured person calm to avoid further damage. So this type of wounds need immediate medical attention because it's important to prevent internal bleeding and infections. Then there are contusions. These are also a type of bruises, but this can be caused by a fall or blunt force impact, like hitting a hard object. This can be followed by swelling, redness, and severe pain in the affected area. And internal damage might also occur, and it might be greater than what appears on the skin. So you might not be able to explain it by the look of it. There could be internal damage, and that may lead to fractures or internal bleeding in severe cases as well. So for first aid, you can follow the PRICES protocol. Protection, rest, ice, compression, elevation, and support. So protection means you kind of avoid further injury. Rest, you reduce the movement in the affected area. Ice, that means you apply ice to reduce the swelling and pain. Compression means you wrap the area with a bandage. Elevation means you keep the injured area raised. And support is to use additional support if needed. So it's known as PRICES protocol. If there's severe pain, swelling, or any other type of fractures, like suspected fractures, you can seek medical attention immediately. Anyways, you might have to seek medical attention. Here we are going to talk about blisters. A blister is a painful red swelling filled with fluid. It can be caused by friction, such as from new shoes or sports equipment, or it could be because of burns. The first aid and prevention is not to pop the blister in order to prevent infection. And if it's broken by any chance, keep it clean and avoid any tight coverings on it. And wash the burn injuries. If it's like a burn, you can wash it off under running water in order to reduce the blistering. And wear well-fitted shoes and sportswear to prevent blisters. And using the same equipment for practice and competition is also a good strategy to avoid friction injuries. So again, here we are looking at the PRICES treatment. I guess you have heard of RICE treatment. It's a commonly used method of giving first aid for internal injuries. So PRICES treatment is the latest addition. It's a further development of the RICE method. So we talked about the PRICES treatment in a previous slide. So I think we have covered this part. Next, we are going to talk about the internal injuries, and we'll be talking about fractures, joint injuries, ligament injuries, muscle injuries, injuries to nerves and other internal organs, and accidents that can happen due to the increase of body heat. So a fracture is a break or crack in a bone. It can occur in limbs, that means your arms and legs, or it could be your skull, or it could be any other bones. And it could be an open fracture, which means the bone is exposed, or it could be closed. So the first aid and management involved in this are keep the affected area immobilized, that means don't move the affected area, so you can prevent further injury. And also, like, do not move the injured limb unless it's really necessary, and seek immediate medical attention. So if it's an open fracture, what you can do is you can just cover the wound with a clean cloth to reduce any infection risks. So a joint injury could be a dislocation, that means bones in a joint move out of their normal position, and this can cause fractures and ligament damage. First aid and management is to keep the joint immobilized to avoid further damage. That means do not move the affected area, and also do not try to reposition it by yourself. What you can do is seek immediate medical attention, and also you can apply a cold pack to reduce swelling and pain. So next in our list is the ligament injuries. Ligaments are strong tissues in our body that connect bones. So these damages can occur due to accidents, or maybe due to excessive stretching, or even due to sudden movements. The symptoms are swelling, pain, and difficulty in moving the joint. So for the ligament injuries also, one can follow the Price's treatment. And then the muscle injuries can occur due to piercing, contusions, cuts, or even due to fractures. So a muscle strain might even lead to muscle tears. So this is common in athletes or even in physically active individuals. What you can do to prevent this is to have proper training, and also to follow a proper warm-up regimen and stretching before and after activities. And in any case, if there's a muscle injury, you can follow the first aid and treatment. You have to rest the injured muscle, apply ice to reduce swelling and pain, so that is first aid, and then you have to seek medical help if it's severe. Then the injuries to nerves and internal organs. So the common causes are high impact sports like rugby, football, boxing, and martial arts. Falls, hard knocks, or collisions with objects or players can also be causes. Types of injuries are brain injuries. That means the injuries could cause a concussion. That means it could be a concussion, and then there's temporary brain damage due to the impact. Or it could be other internal organ injuries, maybe to the liver, spleen, kidneys. These are like high risk organs. And it also could be other internal bleeding, which can cause paleness or fainting in a person. First aid and treatment is to seek immediate medical help, and especially you should not delay hospitalization if you suspect that there's an internal bleeding. And we have come to the last part of the lesson under this subsection. So accidents due to increased body heat. The causes are outdoor sports, especially if you are doing it during the daytime. Intense physical activity in hot environments can also do the same. Either you are doing the physical activity intensely in hot environments, or it could be any other outdoor sports that you are doing during the daytime. So the common heat related conditions are causing cramps, heat strokes, and dehydration. What you can do to prevent is try to, if it's possible, try to schedule the events in the morning so that you can avoid extreme heat. And also you have to make sure that you provide hydration stations for the sportsmen, like that means like if it's a marathon, water at feeding points, and wear light and breathable clothing because sportswear also matters. First aid and treatment is to give cold water and apply ice to lower the body temperature, and you have to seek medical attention if the symptoms persist. Thank you very much for listening, and there are some more lessons to come, so subscribe and stay tuned with us. See you next time.